every conversation about scar tissue online is about how it looks. Silicone sheets, creams, fading it, before and after photos. Almost nobody talks about what it's doing on the inside. Here's the number that stopped me. So, according to the National Institute of Diabetes and Digestive and Kidney Diseases, of people who have had an abdominal surgery, 93% form adhesions. 93. Now, I want to be careful with that because most of these people are completely fine and never have a single symptom. That part is true and it matters. But there's a group of women who are not fine, who have real symptoms, and who have never once had anyone ask about the surgery they had 6 years ago. An adhesion is a band of tissue that forms between things that are supposed to stay separate. It can connect a loop of intestine to another loop or to the wall of the abdomen. Normally, everything in there has a slippery surface, so it can glide as you move and breathe. Adhesions take that away, and they can get tighter as time passes, which is why the problem can start years after the surgery and not right after it. Surgery on the lower belly and pelvis carries the higher chance. That is a bowel surgery, a gynecological surgery, which means C-sections, hysterectomies, endometriosis is surgery, and ovarian surgery are at the top of the list. That is a huge share of the women watching this. Now, the part I will not skip because it matters more than the rest, adhesions are the most common cause of small bowel obstruction, and an obstruction is an emergency. If you ever have severe belly pain with vomiting, a swollen belly, and you cannot pass gas or stool, that is the emergency room. Not a supplement, not a phone call to me. Go. What I do work on is the part underneath: tissue quality, movement, circulation, and taking the load off the body that has been compensating for years. And for anyone with a fully healed scar who has been cleared by her provider, gentle body work on that scar with their own hands is often the simplest place to start. Fully healed, cleared first, gentle, stop if it hurts. I'm not going to tell you that anything dissolves scar tissue. I am telling you that your body has been working around something and that it is worth naming it out loud. So if you want to understand what this pattern actually looks like, I put the whole thing on a page for you. It's in the caption.